I'd like to yield 5 minutes to my good friend, the ranking member of the Subcommittee on Health, Ranking Member Julia Brownley from the great state of California.
The gentlewoman from California is recognized.
Thank you, Madam Speaker. I rise in support of the Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act. As you know, last week on Veterans Day, many of us attended events in our congressional districts to commemorate Veterans Day and to honor the men and women who have served our nation in uniform. As members of Congress on Veterans Day, we recognize every man and woman who has answered the call to duty. In fact, it's been nearly a century since Veterans Day was first established as a federal holiday in 1938. While celebrating Veterans Day is an important tradition, we also owe our nation's veterans more than words of thanks. Our words ring hollow if we don't do our part to fulfill our nation's solemn promise to serve our veterans and their families as well as they have served our country. As you may know, access to long-term care is one of the biggest challenges facing our aging veteran population and the families who care for them. I have been working for several years now to address this need, working with former Senator Elizabeth Dole and Elizabeth Dole Foundation and veteran service organizations, and with my colleagues on both sides of the aisle and in both houses of Congress. I was proud when the bill passed the House in November of 2023 with overwhelming bipartisan support. But it's been a year, and we simply cannot deny our veterans this crucial care any longer. We must get the Elizabeth Dole Home Care Act across the finish line and signed into law. Passage of my legislation would be the most impactful change in VA long-term care in decades. It would also be one of the smartest. Currently, every veteran enrolled in VA has the right to nursing home care, if clinically eligible. But it's important to note that nursing homes are not where veterans want to live their golden years. They want to be at home with their families and in their communities. And it turns out care at home is also less expensive than institutionalized care. And probably most important of all, that health outcomes are far, far better by receiving care at home than it is in an institutionalized setting. As you all know too well, our healthcare system is facing a silver tsunami as baby boomers enter their later years. VA is not exempt from this tsunami, and immediate preparation is critical. Almost half of VA's patient population is over 65. Without fixing veteran home and community care in the next 15 years, VA will double its spending on institutionalized long-term care services, nearing $15 billion to meet these needs. Congress has a great deal of difficulty coming to agreement on most things, but we all agree that long-term care at home is better for our veterans, it's better for the VA, and it's better for our country. I am very proud to say my bill has been incorporated into the Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act. The package before us also includes legislation that Senator Sanders and I have worked on to create a new pilot program to expand VA comprehensive dental care to veterans diagnosed with diabetes and other heart disease, as well as numerous bipartisan bicameral provisions to improve VA's benefits for veterans. I want to thank Chairman Bost and I want to thank Ranking Member Takano for your work to reach an agreement on this package that will help veterans all over the country by delivering the relief caregivers need and the relief that veterans need and what they have been advocating for. And I again thank the Senator Elizabeth Dole for her help and support in making this the perfect bill. And with that, I yield back.
Gentleman